So you know me, Jamie, but I'm a GP and do some work in the media as well. But I've been creating some content and what have you on the testing program. So and I've been to I've sort of been updated on the latest. So available to answer any of your questions.
Great. Okay. Well, I'm Jamie, and I adopted my sons with my boyfriend Tom about 7 or 8 years ago. And when they were 4 and 5, and they're now 11 and 12. So we've got Richard, who's in year 6 at primary school. The testing for COVID sort of thing doesn't really apply to him yet because they don't do testing at primary school. And actually, their primary school is quite small and quite well distanced and well organised. So we're not too concerned there. But Lyle's in year 7 at secondary school. And of course, he's been back to school now twice in a year. So he still feels like a new kid, even though he's kind of almost a year in, And of course, since I think maybe February, when they went back, maybe January, I can't remember, they've been testing to begin with at school, I think twice a week for the first few weeks, and then now at home. So we've received packs from the NHS with multiple flow tests in them that look a bit like little pregnancy tests. And Tom has been trying to be as regimented as possible with the testing process. But of course, and I'll just read out the notes because I had a good sort of brainstormy think about this last night. So the problem is, how I see it anyway, is that right from the beginning of COVID-19 last year, kids and young people have received the message that they present very little danger to anybody and that COVID actually shouldn't affect them too badly. They're not too much of a risk to anybody. And that's from messages from the government, and then also from like things like them being sent back to school and all that related stuff. And our kids, we see them as quite typical in that they basically can't be bothered with anything that isn't completely necessary. They're quite lazy. So we feel it might be a little too late to convince them that COVID and all this testing is really important. And it's quite a culture shock, I think, for them. And to add to that, however well meant they are, the kids are really, really lazy and they rush through everything. And I mean, that's from anything from brushing their teeth to going in the shower to packing their school bags. I mean, one of our kids has left his school iPad at home this morning because they're just in such a rush all the time. So with all that in mind, what we as parents do to make sure that Lyle in our case is using the test properly and spending the adequate amount of time to get a reliable result from it, because we're really worried that even with us watching from the other room, he's just sort of rushing a bit like he does when he brushes his teeth. And we don't necessarily always want to be stood right behind him with our hands on his shoulders because he's 12, he wants to be independent. So what can we do as parents?
I guess I'll just say very, very briefly that I think first and foremost, like, well done to Lyle that he's doing it.
Yeah.
And I think to expect everyone to do this and do it perfectly is not realistic. So even if he's doing it and you're seeing from the other room that he is doing it, if he's not doing it perfectly, it's still much better that he's doing it than not doing it at all. So I think, it's still a win-win. It'd be great if he would do it perfectly, but the fact that he's doing it is better than nothing.
Because our main concern, right, was the fact that putting a swab on the throat of a 12-year-old is kind of a bit like a horror show. Like, we're never quite sure what's going to happen or what kind of tantrum we're going to end up with, or it could go really well, it could go horribly wrong. And so our first main concern when he went into school that first morning for a COVID test was, the worry was, it's either going to be a huge embarrassing episode, or it's going to go really well. And I think because the kids were all queuing up and they could see their peers in front of them doing their tests first, I think it gave them that kind of sense of bravado. So I'm hoping that's at least the tests at school went really well, I suppose. So the other thing, I think another message.
Can I ask you a question on that, Jamie, before we move on? Because I'm quite interested, I think, from some of the feedback I've had from parents, I'm quite interested in how well the message has landed to parents, that they ideally would be testing as well. Have you received that message? Because I guess the sense I've got from some parents is that, the test is available to us as well if we want to do it, whereas I think actually the messaging is we really want to encourage parents to do it as well. So I wondered just kind of how that message has landed with you.
It hasn't. That message hasn't got through at all. I mean, Tom and I have been testing periodically because Tom has been helping shift furniture with his parents, for example, a few weeks ago, and so he did a test to make sure that he was sort of safe to see his mum and dad, who are a little bit older. I've taken a couple of tests because I'm doing the school. Basically, I'm the school-run parent at the moment. So although we do share responsibility at the moment, that's how it's fallen. And so I'm doing the grocery shopping, all the useful stuff at the minute with the kids. So I've been doing the occasional test, but certainly that isn't because the message has come through that I should be doing that. It's just kind of available to me, so I've done it, you know. And I worry about my mum and dad and people. So
well, that's interesting, because actually the message, ideally, all parents who have children in primary and secondary school, all people who work in a school, but also the people who share households with the school bus driver or the school secretary. In an ideal world, Public Health England want everybody to be testing twice a week. So actually, you, Tom, and Lyle could, on I don't know, whichever days you choose, say Mondays and Wednesdays, Mondays and Thursdays, right, it's a Monday, it's testing day, who's up first? You might even end up in the scenario where your youngest son might feel a bit left out. We were talking about this earlier, and we're like, you know, if he wants to do it, then he doesn't need to, because he's below that age threshold.
He's as cool as a cucumber. He doesn't care what anyone else is doing. It's his own little like island. You know.
But that might make that easier, because ideally, you know, you guys would all be doing it twice a week.
And I think when we can start mixing a little bit more, for instance, go and see my mum and dad in the garden for a coffee, I think that's going to become more and more important, certainly to me. And so I will be a little bit more routine about it. So I put a little poll out, or a question out to my followers on Instagram and Twitter. And so I've got a couple of slightly more specific questions, which Dr. Zoe, you might actually be familiar with some of these things, because this comes from a friend of mine who's pregnant.
Okay.
She's about 15 weeks, I think, or 16 weeks pregnant. So, which is quite exciting. But anyway, so her first question is, with the restrictions loosening, how risky is it to meet with other households while pregnant, especially when a lot of people aren't yet vaccinated, who can't generally get testing very easily?
Yeah. So the answer on that around pregnancy, and this has been quite confusing, because this time last year, as we tend to do, we put pregnant people into the vulnerable group until we knew more. And as the evidence has come out over the months, we know actually that, and this is different to flu, when it comes to COVID-19, being pregnant doesn't make you any more susceptible to getting severely unwell or ending up in hospital with COVID. Obviously, you know, you're just still as likely to get it, but the illness that you're likely to have with it will be the same as if you weren't pregnant. Whereas with flu, we know that that's different. If you get flu when you're pregnant, your immune system is functioning slightly differently, and you're more likely to end up severely unwell. So there's kind of that reassurance there that being pregnant doesn't make you more likely to end up with a severe illness. But there's one caveat, that if you do get COVID whilst pregnant, and you are unfortunate enough to end up being one of those people who does get severely unwell, particularly if you're in the third trimester, I think you said she's 15 weeks, so she's not there yet, so beyond 28 weeks, if you did require, you know, breathing support, mechanical ventilation, anything like that, it's much more, it can make it more difficult, you know, so it can make it more difficult to treat a woman who is heavily pregnant with these measures. And we know we've seen people being proned and turned over. So the chances of becoming severely unwell with COVID when you're pregnant are not any higher. But if you're in the third trimester, the advice for people in the third trimester is to be extremely cautious, because it could be more difficult to treat. So anyone beyond the 28 weeks should be extremely careful, but you can still go to work. You don't need to shield. Anyone in the first and second trimester, you don't necessarily need to take more precautions than if you were. But I think, you know, being pregnant myself, you just do, you know, you are just on high alert, and that's not a bad thing. It's a good thing. It's a sensible thing. We should all be being careful. And I think being pregnant makes you that little bit more scrupulous. So that's that.
Okay. And finally, then, this is from one of our followers as well. How reliable are lateral flow tests for result monitoring? Is it safe to be around kids who have been tested negative recently if you're pregnant? I guess it's kind of related to the question that I've asked before, that touches on the fact that maybe people have the perception that flow tests aren't 100% accurate.
Yes, I think when it comes to lateral flow testing, because we know it's not as sensitive, or as it's not, it's not going to pick up everybody who has COVID-19, but it's very good at picking up those who have what we call a high viral load, so who are likely to be more contagious. So people who have a viral load that's high enough to be contagious, it picks up 95%. But I think the thing to say is with lateral flow testing, if people around you are getting negative results, you carry on as normal, you still socially distance, you still follow all the rules. The only time you really do something different is if somebody gets a positive result, and then obviously that person in the household must isolate and take all the measures and get a PCR test. So people having negative tests around you shouldn't make you feel more confident that you can touch them and hug them if you wouldn't do otherwise. You almost ignore negative tests and only act if there's a positive one.
That's really good advice. So I guess in summary then from our conversation, the tests are really important, and we should encourage the whole family to get involved, so that everybody can be a little bit more confident that they can go about their ordinary sort of lockdown business. But not super confident enough that you might put yourself at risk. And also that pregnant people before their third trimester are equally at risk as other people, and should therefore be careful, but not necessarily go overboard with being hugely frightened about kind of going to the supermarket or sitting in your parents' garden and having a cup of tea.
Yeah, definitely.